It is late afternoon on the shores of Lake Malawi, the third largest lake in Africa. It is a paradise of biodiversity and an essential source of survival for the local population. But the lake is contaminated. The village of Nkali, like many others near the lake, is experiencing a cholera epidemic. Doctors Without Borders, the health authorities and the locals have all swung into action. Labana Stevens from MSF is checking in with the village chief. A few days ago, more than half of patients admitted to the hospital for cholera came from this village. Another key element is convincing the locals not to relieve themselves in the lake, the most likely source of contamination in the water. 30 volunteers are taking part in this effort, distributing chlorine to kill the bacteria.
This is very important. In order to cut the root of contamination, people need to understand hygiene practices and how they can prevent cholera at household level, including in these fishing communities. In the case of the lake, people can still draw water from the lake, but we need to treat that water before they drink.
Anna Kola is one of the volunteers this afternoon. The Nkali resident is very aware of the danger posed by the lake water. Drinking, bathing, washing dishes and clothing, and rinsing food can all cause contamination. We met up with Anna again at her home in Nkali, near the lake. It has become habit now. Anna is 37. She was widowed in 2020 and is now raising her 2 children on her own. She had used the money her husband left her to buy 2 small fishing boats, but they were stolen last month, so she no longer has a source of income. Cholera spreads quickly in poor populations. In Malawi, one of the poorest countries in the world, half the population lives on less than $2 a day. 2022 was even worse than previous years. Their currency lost 1/4 of its value and inflation went up more than 20%. The cost of food has gone up more than 34%. Anna can no longer afford to feed her family properly.
Before it was cheap, but now it's expensive. Since maybe 4 months now. Yeah. Before that's when it was 200 before. Now it's 500. It's expensive now.
In other words, a packet of biscuits now costs 45 euro cents instead of 18. A kilo of sugar now costs €1.50. In these conditions, no one can afford to buy soap or chlorine to protect themselves from cholera. This growing poverty is undoubtedly a contributing factor to this epidemic, the biggest in Malawi in 20 years. In January 2022, Tropical Storm Anna caused flooding in the area. The first case of cholera in Malawi was detected shortly after, in March. Then the epidemic started to slowly spread until the explosion of cases in October and November forced the authorities to declare a public health emergency in early December. In Mangochi, the Kochi clinic was quickly overwhelmed. Doctors Without Borders decided to set up a cholera treatment unit there. working quickly to respond to the outbreak of the epidemic.
When we got here, there were so many patients on the ground, limited staff, limited medical supplies, so we had to quickly move in from day one, providing case management for patients, but also setting up the structure. Here we have a triage area where we have our medical staff, the doctor, the clinical officer, and also the nurses. They are looking at the patients, looking at the signs and symptoms of the patients, and finding where to place them in terms of the cholera treatment units.
The centre has 70 beds.
Sometimes it's not enough. We have days where we have had 80 admissions in a day. Then we have to look around for more space. Like we can have chairs for patients that are not severely dehydrated.
A new structure is being built in order to offer the patients better protection from the rain. The rainy season is just beginning. Noria's son has been hospitalized for 4 days, but he is doing much better now.
Meni mabwaya kuno ana atatsegula ndikufoka kwambiri. Nde sinaziwa kuti ndikolera kuma naona bezisonyezo amabiba zotuwa.
She was right to bring him here. Cholera is a fast-working intestinal infection transmitted by contaminated food and water, which causes severe diarrhea and vomiting that can be fatal. The treatment is very simple: rehydration by intravenous injection. But first, the patients must make it to the hospital.
Most of them, they prefer to come during the night when it is dark, so that they will escape from all this shame which came with this diarrhea disease. So I'm sure it's really happening in the community that most of people are coming late because they are feeling shame to travel during the daytime.
The protocol is clear. Only one person can accompany each patient. Doctors Without Borders provides meals, unlike for the rest of the clinic, to avoid contamination. Once there are fewer than 10 cholera patients a day, the NGO will relocate to wherever the public authorities deem necessary. But that will take some time.
With the start of the rainy seasons, most likely we'll have a surge in cases again. When we started, there were 93 admissions. Then the cases went down to about 40 per day. At some point, we thought we were winning this response. Then again, we got 80 patients in a day.
The fight is just beginning, but at least the medical staff have one powerful ally they can count on: the vaccine. In Nakata Bay, on the northern shores of Lake Malawi, the vaccination campaign has already begun. Staff from the Ministry of Public Health have set up near the market, downtown. It doesn't take much: a bench, a cooler, a tree for shade, and an oral vaccine, easy to administer. Milka Kotza is in charge of promoting health at the hospital.
We had cholera in 2018, but it was not as much severe as this time around. Yeah, in 2018 we had 16 cases and no death. But this time around we're having more than 1,000 cases, and we are leading death. We are at 40 deaths since we experienced this pandemic.
Cholera map within 6 hours. Once infected, each kilo.
Gosh, did you move in
Madulira tu?
Yaga.
There is lots of cholera outside here, and I want to prevent cholera from attacking me and maybe my family as well, and so on and so forth. Yeah.
The vaccination team also visits the surrounding villages. Fortunately, it has not rained today, so the road to Chinyafwa is accessible. The public health authorities have set up meetings in advance to educate the population, just like they did for the COVID-19 vaccine. In this cooler, they have 61 doses of the cholera vaccine. ARTE Shulezi, a licensed practical nurse, is in charge of administering them.
There's some misconception. People, they say, if they get this vaccine, they don't bear children. That's a not lie. We do say that to them, then they do accept them. That's why you have seen many people coming here, because they had already information before.
The district of Nkata Bay has received just 27,433 doses for a population of around 165,000, which is far from enough. There is a global penury. 36 million doses were produced in 2022. Malawi received 2.9 million of them, but there is high demand everywhere. 29 countries are affected. As a result, the WHO is now recommending just 1 dose per person, instead of 2. For Robert Mazokwa, it's better than nothing. What matters is that they can preserve the health of the population and Malawi's struggling health system.
With 1 dose, people will be protected, but not for much longer. But I will say not much longer, but not fully protected. But if we get 2 doses, then we are fully protected. Yes, for a period of time, maybe for some years. It's better than nothing. Now we have got 1 dose, we are prescared.
From vaccination to prevention, Stonard Siska, the village chief, is a firm supporter of all the efforts to fight cholera.
We have a borehole down there. We are using a borehole. Yeah, so in addition, we are provided with a chlorine to be added to water. Yeah, so that whenever we drink that one, we should be drinking that water which is safe.
It's a big day for the people of Malawi. The Wells for Zoe organization is coming to install a water pump under the supervision of Harrison Amin, the director.
We came this village to give them clean water, whereby we dig the well. The communities themselves dig the wells, and then we support them, provide them with cement, bricks, and the technical support to build the well and then put in the pump. It's just 2 pipes, the 50-meter pipe and the 40-meter pipe, and they're very easy to pump. And we also teach the communities how to maintain them.
This will make a big difference in village life. Every pump the organization installs benefits hundreds of people.
Pakwamba maji yangu panguveje tasuzikanga tatekanga maji kutari kweni sono mama zoe vatipira chisimichi ndikuti maji timwenge pafupi
ngakusuka chomene ngakusuka ise kwakuyana na ise kwatazimai ngakusuka cha ngapuswaka topaishi kuchipokerera makura.
There is no more need to travel miles every day for water. Young girls can go to school, while women can grow food or even work. Their quality of life is greatly improved.
So nti maji numoyo kweni maji tikumwetapwerere makola kuti patafuma kutagwisa ntchito maji ya tivuye so tiwe na umoyo wa thazi asi ndena amawo kuti atenti tikuizo.
In this other village, the pump was installed 1 year ago and has become a gathering place for the women of the region. The risk of contamination from cholera or malaria has reduced considerably.
Tikashitanga ujimanga visime madambomo ndimo tikatekanga tikashitanga ujimanga visime tikamwiranga umoza na tudonono mbweni.
In Malawi, nearly half the population has no access to drinking water or health infrastructure. To break the spiral of poverty, Wells for Zoe, a small Irish organisation, is working on reforestation, improving access to school and education for girls. But the priority is still access to drinking water. The pumps are made in the organisation's headquarters in Mzuzu. All it takes is 2 PVC pipes, a wooden handle and a check valve. There is no risk of corrosion.
These are the ones when the people are drawing water, these rubbers come on, he do this, and the water goes up. After that, this rubber closes, and the water remains on the valves without going back to the well.
The valves are made out of recycled plastic, previously used to protect trees. It costs less than €100 to make a pump that will change the everyday lives of many villagers. Back in Mangochi, Doctors Without Borders has received a call for help from the public hospital in Monkey Bay, which is overwhelmed by a flood of cholera patients. Tatenda Gonye has come to evaluate the situation. The first step is to visit the cholera treatment center with the director.
So I can have a look?
There are 2 tents with some 20 beds, but with 15 patients admitted each day, it is not enough. Patients must stay for at least 48 to 72 hours in the best case scenario.
Inside there's lighting, but outside now to move around, even for the staff.
The protocol here is nothing like the Doctors Without Borders treatment center. There is no disinfection for visitors, no monitoring, a very small staff, and very little money.
How much are your cumulative cases to date?
310.
Okay. And for patients, is the hospital providing food for patients?
No, it doesn't.
Okay. So guardians or family members are bringing in the food?
Yes.
And there's risk of spread, contamination here.
We are still asking for more medical supplies because today we can have a lot, but by the end of the day, we'll completely have nothing because the cases are still coming. And we are still asking for more health workers to come in and assist us. There are some times when we have asked our patients to go and buy some supplies. So that is not a good sign. It means we are struggling.
The region of Mangochi is the epicenter of the epidemic in Malawi. At the Kochi clinic, where MSF has set up their temporary regional headquarters, Tadenda is speaking with Claude Quitonda, the epidemiologist in charge of coordinating the efforts.
Because at some point we had 80 admissions. Yeah.
Ici, c'est très compliqué parce qu'on a des hauts, on a des bas, on a des hauts, on a des bas. Cela s'explique surtout par le fait qu'on a 2 voies de transmission. Donc nous avons le lac qui est contaminé et qui est une source principale de l'eau. Et puis nous avons les gens contaminés qui contaminent les autres. Vous voyez par exemple en Cali, on a 3%, presque 4% de la population qui sont touchés. Ça c'est énorme. Nous avons une stratégie qui vise les villages qui sont hotspots, donc qui renvoient beaucoup de patients. Et aussi une stratégie pour les villages qui débutent.
If several of the newly admitted patients come from the same village, MSF launches an outreach campaign.
We are going to a certain village called Mfunde. We are going to do the community engagement because we had a few cases of cholera, new cases.
Tivongi Gondwe is going door to door, targeting 40 households located near cholera cases reported by the hospital to inform them and examine the risk factors.
Tikupita anyumba iyi alipo? Takupezani tu. Ife ndifa chipatala tikuchokera kukoche. Ndi malinga ndi matenda atigwera Cholera timazungulira nawo muzimu kufusa nawo mafuso awiri angapo kuti tione kuti kodi pakuvuta ndipati.
Chimbuzi chilipo?
Chilipo.
Buffalo sambe?
Chilipo. Akatunga mazi aja tumeke pamoto kupika kuita nyumba. Akazizira kumama.
Uku aliko anthu? Mama. Uku anthu aliko ngati? Anthu apita kuti uku? Alipo nyumba amene anatsegula mimba kapena kusanza?
Pana ali kuchipatala.
Pompano ali kuchipatala? Oh, apita liti? Dzana.
Chimbuzi chilipo?
Chili kutiko chimbuzicho? Not okay. Not safe.
That's safe?
Yeah. There's no any hand washing facility. I just came to see if they have a hand washing facility. Yeah. So we had 2 patients from this household. The other one is still at the CTO. Chabwino akaka ndikapepala kamene tikhala ndi msonkhano apa pa mtengo ule apo pali galimoto pacha. Ndi mukabwera mutibweresa kukapepala chizindikiro choti inu ndi ine nali pa khompano ndikapepala kwete.
Chifukwa timamva mawayilesi kuti Cholera ilipo.
It's not everyone who can get the message. So yeah, some of them are aware. And some of them are they don't really know, and with the misconceptions, some think that there's no Cholera.
With women on one side and men on the other, this meeting in the shade of the tree is the last step of their visit to the village. Tivonge uses drawings to teach the locals.
Pali chithunzi eti? Ndeni ufuna kuti mundiuze kuti pa chithunzipo pali chani ndipo chikutithandiza ife chakapaya chikutiphunzitsa chani.
Ndanyamula pepalali. Pepalali pali anthu. Mwana akuzegula mimba akazera pa chimbuzi. Pachiwiri mwana akuzaza ndiye akuzazira mujeni beseni.
Mwana chakulwala. Akubutichira kuchipatala.
Zimene zijazo. Ndikavutitsitsa anafotokozawa kasungulidwe kathanzi eti? Kasungulidwe kathanzi wa kunyumba. Shuga ndi chani? Ndi mchere pang'ono. Munthu azimu akupita kuti? Kuchipatala.
Each family is given a bucket with 5 bars of soap and a chlorine solution in an attempt to prevent further contamination. The main problem in Malawi remains access to potable water and public health infrastructure. The prevention teams pursue their operations tirelessly, going from village to village. But the numbers keep rising. Cases tripled in November and December. In 2022, nearly 600 people died of cholera in Malawi, even though it is a treatable disease for which we have vaccines. It is a disease of poverty.